I'm Dr. Ben Radcliffe. I am the Chief Operating Officer here at Nazarene Health Ministries and at Nazarene General Hospital, Kujup here in Jawaka. I'm also a surgeon, and we're talking here today about the severe funding and supply shortage crisis that we are experiencing, but also other hospitals and facilities across the country are experiencing. We have gotten to a point where we've exhausted our reserves, and we do not think we have enough funding to make it into early next year when next year's allocations will be coming around. And so that's going to require that we begin to shut down services here over the next several weeks. Currently, we're limiting the number of patients that come from long way or outside the province, as well as we're not doing elective surgery. The hope is that we will get funding before we have to close completely. But if we do not receive funding here in the next few weeks, starting December 1, all of our outpatient services will close. The following week, we'll start to limit our admissions and A&E, accidents and emergencies, as well as our deliveries, with those services fully closing the week of the 15th. And between the 15th and the 22nd of December, we'll be discharging the patients that we have in our care and be fully closed by December 22nd if we do not receive 5 million kina in additional funding to help us run operations here.
That's from the provincial government or from the national government?
We need help from anywhere we can get it. So we're asking the national government, we're asking the provincial government, we've asked our PHA. We need assistance, and we'll get it from anywhere. We've received less than 25% of what our allocation was allotted for this year. And we've also had the extra difficulty of the area medical stores and supplies that are supposed to come through the government system not coming reliably as they have in the past. And so we've had to spend more money on supplies and medications, other consumables than we ever had before, and that also has severely impacted our ability to care for patients here at the end of the year.
Kujup Hospital is the only hospital serving the population of Jawaka. So, what's the patient per day? Outpatient and then admission.
Outpatients and admissions per day can range anywhere between 150 and 300 depending on the day. Mondays and Tuesdays are usually much busier than later in the week, but emergencies can happen anytime. Due to the local council elections recently, we've seen lots of trauma and violence related to that, so we've had an increase in our trauma and casualties related to those things, and that also is an issue here at the end of the year as the festive season starts. So this is not a good time to be closing down because we generally see an increase in patient volume this time of year.